continue then with our first session, and we will have a presentation from Dr.Sue HORTON on investing in nutrition, a cost-effective approach. Dr.Sue HORTON is a professor of economics, specialized in health, nutrition, and labor market issues in developing countries. She has worked in over 20 countries, developing countries, and has consulted for many international agencies, including the World Bank, the Asian Development Bank, etc. Please, Dr.Sue HORTON.
Good morning, salam alaikum, bonjour. Je ferai la présentation en anglais, mais au commencement, je voudrais dire simplement que je suis très heureuse d'être ici à ce congrès très important, avec ce thème très intéressant et dans cet endroit très agréable. So thank you for inviting me, even though I am an economist. Economists are known as the dismal science. Or sometimes they say of the economist, it is the man or woman who knows the price of everything but the value of nothing. So I am going to try and cover a large range in my short talk. So to start off, just summarizing very briefly the conclusions from the Lancet series in 2008, of which I'm sure you're familiar, showing that nutrition interventions can be effective. Then I would like to summarize some information from the Copenhagen Consensus, in which I participated in 2008, which showed that not only are nutrition interventions effective, but they are also cost effective, that they are high priorities for development. Thirdly, I'd like to talk about some ongoing work after the Copenhagen Consensus, the Scaling Up Nutrition plan, which is being promoted in recent years to try and bring nutrition back in a big way on the international agenda. And I'll talk about some costing work that I participated in as part of that to show not only are nutrition interventions cost-effective, but they are also affordable. It's feasible to make these interventions. And then lastly, I will summarize some of the more recent developments and why we can be optimistic that nutrition is taking a place on the international agenda. So to begin with, I'm sure you saw the Lancet series, these 5-part series that talked about the nutrition interventions that are effective. And this series was very useful in that it also identified the countries of greatest priority, those 36 countries which account for 90% of the stunted children worldwide, plus a smaller group, a group of smaller countries, 32 countries, where stunting, although it's not a big burden worldwide, it contributes only a small amount to the global burden, is nevertheless very important in those countries. And the Lancet series identified for us 14 interventions which should be undertaken in all contexts for appropriate nutrition, and 9 interventions which should be undertaken in some countries. So, and I'm sure you're all familiar with the 14 interventions which are important in all contexts, both for mothers, for newborns, and for infants. Okay, and I apologize, sometimes I've used short forms of things, such as USI is universal salt iodization, SAM, severe acute malnutrition, just to fit on the slide. Okay, similarly, there are 9 interventions that should be used in certain contexts, either because malaria is particularly severe or because salt iodization is not feasible in that context. Okay, and we've already mentioned this morning the 1,000 days window for intervention. On this particular chart does not show you what's happening in utero, but from conception until almost 24 months, there are 1,000 days where it's key to intervene to ensure the nutritional benefits are the greatest for the child. Okay, and the previous talk talked about some of the adverse consequences in later life for children whose nutrition in utero and in those first 1,000 days is not optimal. Okay, I'll spend more time talking about the economic evidence. So this photo was taken at the Copenhagen Consensus in 2008. So the Copenhagen Consensus is a bit like the Olympics. It takes place every 4 years. So the first one was 2004. I was present for 2008, and there is another one coming up in 2012. And it occurs in Copenhagen, and it's been the brainchild of Bjorn Lomborg, who you will see there wearing his golf shirt, sitting in the palace in Denmark next to Nobel Prize-winning economists and to the Prime Minister of Denmark, you know, but looking very informal and looking maybe like a tennis star or something like that. In the Copenhagen Consensus, they get world-renowned economists to rate and to rank development priorities. And they ask another 30 economists to write papers evaluating development interventions from the point of view of benefit cost. And then they are the ones who make the consensus and determine what the strongest priorities are. So there are 5 of these economists won Nobel Prizes in economics, and you can see the biases because evidently no women have won the Nobel Prize in economics, not many Francophone, and not many developing country economists, Amartya Sen being one exception. So they also invited 3 economists who were a woman, a Francophone, and an economist from a developing country. So it was a very interesting experience to present to this group. Here was the final outcome, and I will explain a little more how this was reached. So something like 35 development interventions were ranked by this distinguished panel, and here I have listed the top 10 interventions. And I was very happy because I had co-authored the paper on malnutrition and hunger with 2 colleagues, Harold Alderman from the World Bank and Juan Rivera from Mexico from Public Health. We promoted 5 solutions for problems of hunger and malnutrition, and you will see all 5 of these were ranked in the top 10. Okay, and even better than that, the top solution promoted at this version of the consensus was a micronutrient solution. In particular, the supplements of vitamin A and zinc for children. Okay, and the 3rd highest ranked was fortification with micronutrients, with iron and iodine. So I guess it's a bit like the Olympics. If you come top and you get the gold medal, it's a great opportunity to use for promotion and for advocacy. And I'm happy that the 2008 solutions have been used to help underscore the important work being done in nutrition. So you may be wondering, how did the economists arrive at this ranking? So we know that nutrition has effects on health. I will talk about that in a minute. But there are also, it can be shown that we have good evidence that nutrition can have effects on the economy. It can occur directly. For example, we can show, using randomized controlled trials, that adults who have a better diet can produce more work output. Okay, for example, if we supplement adults with iron, they can pick more tea or dig more dirt or build more roads. We can also show more indirectly that nutrition in childhood, both preschool and then also in school, helps children's cognitive development. And we know that cognitive development then benefits wages, which we can infer improves productivity. So children who are better nourished learn more, achieve more in school, and subsequently produce more in the economy. This is true for certain micronutrients, in particular iron, iodine, folic acid. We can show that there are strong effects on cognitive development and hence on adult productivity. Okay, similarly, complementary feeding, deworming have effects that can be measured in economic terms. And for economists, we would calculate the benefits as a ratio to costs. So perhaps you've heard of the ratio, benefit-cost ratio. So for $1 invested, how many dollars of benefit are received? Okay, not only have we got randomized control trials over a short period to show effects on productivity or on cognition, but more recently we have a few longitudinal studies looking at the effect and the outcomes in adulthood of interventions which occurred in childhood. So INCAP in Guatemala did a study, I think more than 30 years ago, and currently they have followed up with the children to look at their effects on their wages, on whether they are working in the labor market, etc. Similarly, there was a longitudinal study in Costa Rica, a randomized control trial involving iron interventions in young children. Betsy Lotzoff has traced the outcomes more than 20 years later in the labor market. And these are very strong studies to show that a randomized intervention can have long-term consequences. And it gives us a lot of confidence that the evidence we have for these benefits of nutrition is strong. Obviously, it's expensive to do these longitudinal studies, and we have relatively few of them, and it takes a long time. There are other micronutrients where the effects are not on productivity directly or not on cognition, but are on health. Okay, we know that vitamin A interventions, zinc supplementation can decrease infection and decrease the probability of mortality. Okay, and as for other health interventions, a good way to measure the benefits of that is cost per DALY saved, cost per disability adjusted life year saved. If you're not familiar with this term, a similar term is cost per death averted. For vaccinations, you've probably seen studies showing what it costs to save a life. Okay, and this is the cost to save a life year, allowing for interventions that also improve.